The topic today we're talking about is the knee. Our guest right now is Dr. Bill Huang, orthopedic physician from Everett Bone and Joint. He's going to discuss total knee surgery with uncompartmental replacement surgery.
Bill is with us tonight, and we're excited to have Bill here because I know personally there's a lot of people out there that have that semi-worn out knee.
Yeah.
And what Bill brings to the table is Bill has a fellowship in total joint replacement, and he knows and understands the latest and greatest. And he's going to talk about total knee surgery versus what we're doing today, or what they're doing today is called a unicompartmental or a partial knee replacement. Bill, how you doing tonight?
Pretty good. Now, Bill, if I could just interrupt right now. It seems to me that knee replacement these days is like going to the dentist. I mean, everybody's having. My mom has probably had it 3 times already. Is that true? A lot of people getting this?
Pretty much. That's one of the most common orthopedic surgery that we have out there, and the prediction is that 2020 there's going to be over 1 million people a year in the United States that's going to have knee replacement.
Wow. Wow. So I've been doing physical therapy for 20 years, and my first job coming out was at Swedish Hospital, and they did a lot of total knee and total hip replacements, and it's changed a lot, hasn't it?
It has. The technology definitely has gotten better. Our material has gotten better, and which is great because we're seeing a lot more people that is younger and younger that has worn out knee and want to stay active, and these knee replacement surgery are more and more designed for younger patients and try to keep them active.
So Younger, like what age are we talking about? Like what are you seeing?
When I was in training, we wouldn't even think about doing joint replacement surgery on people under 65.
Uh-huh.
But now, by far the biggest segment we see that coming to see us are people in the 50s.
Mm-hmm.
As people are active, like to do sports, and their knee wears out, and they want to stay active. And
so Maury has a history of a meniscectomy through a scope. He hurt himself on a treadmill. And
that's my claim to fame.
He's kind of you're having some aches and pains right now, aren't you?
Oh yeah, I have what's it called? Avascular necrosis.
Yeah.
And they told me that I have to have my knee replaced one of these days. This was about 6 or 7 years ago.
So I mean, I'm kind of curious, Maury, what kind of symptoms are you having right now?
So basically, I can't run.
Yeah.
Like I used to. I mean, I go to the gym. I'm on the elliptical, but is basically like sprinting. It doesn't work. I used to run. I used to jog and stuff like that, but I can't do that anymore.
Yeah, I think that's a pretty common thing we hear. There's different causes of knee pain, and osteoarthritis is by far the most common. You have avascular necrosis, which is we commonly seen, but it's definitely not as frequent as osteoarthritis.
Mm-hmm.
But the endpoint is the same. Your cartilage gets worn out, and you don't have the cushioning in your knee, and whenever you do these repetitive exercises, it causes inflammation, and that causes a lot of pain.
So generally speaking, these folks out there with these worn out knees, what would you say is the chief complaint or the biggest complaint that they have when they see you?
I would say pain is by far. Pain is number one. Number two is inability to do the exercises, activity they want to do.
So it becomes kind of a quality of life thing.
Correct. And
yeah.
I think that's one of the most rewarding aspects of my job is to get people back to do what they want and improve their quality of life.
So tell us who that typical candidate is out there for, let's talk about and describe what we would call a total joint or a total knee replacement.
I see two populations. One is our standard grandparents. They're 60s and the 70s that comes in, basically had a worn out knee. They just want to be able to get up, go to bathroom, go to the kitchen, and without any pain. And that is the traditional joint replacement population. But then there's a patient like Maury, who is active, who wants to stay active, who wants to stay fit, and wants to have a higher demand on the joints. But unfortunately, because of the arthritis, that they're not able to do that. And I would say by far that's the fastest growing population for us.
So it's these 40-plus, early 50-year-old athletes that want to stay athletic and maintain some type of recreational
and
functional.
maintain their quality of life. People want to go out and stay active, especially in Pacific Northwest, and people want to stay active.
So by somebody in their 50s has like a knee replacement and they have trouble like running or walking, they're going to get that done and they can just go back and they can start running like, with no pain like it was yesterday. You know what I mean?
That's a harder question to answer.
Right.
Everybody's kind of different.
Uh-huh.
But my expectation is after a successful joint replacement, you are going to be able to return to a lot of these activities. But if you come in to tell me that your goal is to run a marathon after a joint replacement, I would probably advise against that.
Uh-huh.
So in the total knee replacement that you're going to do in the older population, you're taking both ends of the bone, the femur and the tibia, and you're replacing those. Tell us about like someone like Maury, this 50+. What is a partial knee? What's going on there?
Well, I'm excited about this technology because a partial knee replacement, simply what it is, we replace only the part of the knee that's damaged. If Maury comes to see me, only a part of his knee is damaged and the rest of the knee is fine and his ligaments are fine. I like to perform a partial knee replacement simply because I can preserve your tissue and your knee will actually function more like your own knee. And total knee replacement is a gold standard that we use, but I like to preserve tissue, especially in a younger patient, just in case your knee wears out 10, 15 years from now. You have more of your own tissue for us to work on. And I think it's just kind of like changing a tire, changing one tire instead of four tires.
There you go.
You have to rotate them, right?
Yeah.
Isn't that it?
Yeah.
So there's hope then. I mean, this is new technology that is providing, because I know for a fact, just being in physical therapy, how many people come in with that, semi-worn out knee, and what they want to do is they want to golf, they want to ski, they might want to ride their bike. They're still young, they have kids at home, they want to stay active with their kids, and this partial knee replacement is an option for them.
I think it's definitely an option.
That's exciting.
A lot of time is you don't know until the time of the operation or after the MRI to see whether or not you're a candidate, because it doesn't make sense to replace part of your knee if your other part is worn out. So your other part of the knee has to be fairly disease-free for us to consider that. But I would say a lot of the patients come see me are candidate for that. And
so based on their diagnostic test, MRI, and the amount of arthritis or wear and tear in the knees, that's when you make the determination for a partial versus a total. Yeah. And age probably has a lot to do with it.
That's what I do.
So Bill, do you have patients that have this partial knee and they actually return to golf and they return to sports?
Sure, that's my expectation.
Excellent.
Yeah, if we don't achieve that means I think we're not doing something right. The expectation after any kind of joint replacement is to allow our patient to return to the level of activity that they would like to participate afterwards.
So they have the surgery, and is there any kind of recovery, and what is the time frame, and what is your expectations for maybe getting back on the golf course?
Yeah, that's a harder question to answer because I think everybody's is different.
Oh, absolutely, yeah.
One thing I would say is compared to, let's say, just 5-10 years ago, we are a lot better at managing post-operative pain. You probably heard from a lot of people that knee replacement is very painful. It can be, but we're a lot better in doing different kind of modality, try to control the pain before it gets started. So I think the recovery for a knee replacement is much quicker. But with respect to the recovery overall, if more you want to return to golf course after any kind of knee replacement, I would say probably after 4 to 6 weeks, that's the real expectation.
I was kind of wondering, do you have a space opening this Friday so more can get in?
Sure, we'll make an opening for him right now.
Yeah, you'll come in early. We'll get it.
Just knock me out, please. Knock me out.
So that's a really good question.
What are the artificial knees? What are they made of?
Well, they're actually made of very advanced material. Traditionally, a lot of the materials are cobalt chromium alloy, and is a lot of time we also use titanium. All these materials are well tested, is very biocompatible in our body. But there's also newer materials such as ceramic metal composite that's designed for younger patients because it has better wear property.
Will you beep at the airport going through security?
Oh yeah.
Yeah.
But Bill will give you a card. Give you a little card that you can get clearance there.
You'll still get patted down.
Yeah. Okay. I know. Yeah.
How long? Just in kind of rough numbers, how long are these partial knees lasting these days? I mean, is there research out there that kind of indicates?
Yeah. These kind of studies are hard to do because some of these newer material who comes out, we won't know them until 10 to 15 years from now. But based on the expectation is that at 10 years, there's probably a 10% failure rate, but 90% chance that your knee is still doing well. At 20 years, there's an 80% chance that the knee is doing well. And that's 20% failure rate.
That's great. Those are pretty good odds. I mean, particularly if it can decrease your pain, get you back to function and enjoying life.
Yeah. How many knee replacement people do you run into rehabbing?
Well, total knee replacements, we probably do 10 a month or so. But partial knees, like this is new technology, and we're seeing maybe 1 or 2 of those per month now. And Bill is probably doing these on a weekly basis.
Yeah.
Wow.
So that's good. The technology's there. I think we have a caller.
We do. Let's go to David in Snohomish. David, welcome to Health Matters.
Yeah, hello. Yeah, I was kind of interested hearing about that knee situation. I'm in my late 50s, and I have no articulate cartilage, and I've been getting every 6 months those shots, and I have that brace that keeps my knee apart, and I'm just wondering, when will be a point where I have to have total knee replacement? I mean, should I just wait longer? And, where is that point, I guess?
Well, David, that's a great question, and that's, I think, right up Dr. Huang here, his alley. I'm going to let him take this call.
Hey, David, I think that's a frequent question that we get asked in the clinic. But basically, it's a quality of life issue. You have to decide whether or not how much the knee is bothering you, whether or not you want to have the surgery done. I mean, your doctor will evaluate you and look at the x-ray and look at your history and examination to see if total knee replacement or a partial knee replacement will help you. But you have to make a decision on whether or not how much the knee is bothering you. If you're having daily pain, you're not able to do the activity you want to do, and you're just totally miserable, to me, that's a no-brainer. If you have the right disease pattern and the right history and the right finding, I think you'll benefit a lot from considering a joint replacement.
But isn't every year getting better? I mean, I was told, as I said, a number of years ago to have partial. Now it's basically gone. I need a total knee. But isn't every year the techniques are getting better? And
see, that's
would it help me waiting a couple of years? Or?
Well, you have to weigh that against the quality of life issue. I mean,
if you're in pain a lot.
Yeah, if you're in constant pain, require taking a lot of medication, and sure, I mean, we're constantly getting better in every aspect of medicine. The technology, the surgery, the material is constantly getting better. But at the same time, you have to weigh that against your quality of life issue.
David, Shannon here. Are you having pain on a daily basis, and are there things that you can't do?
Yeah, I've really limited what I'm doing right now. I don't walk anymore. I don't play tennis. They said I just those shots that they put in the knee.
Is that Synvisc? Is the Synvisc injections?
Correct, and that seems to work fairly well. But after 6 months, it just
is that goo he was talking about?
That is that.
Yeah, we call it the rooster comb shot.
Yeah, the rooster comb shots. Yeah.
Yeah, so they seem to be working okay. But if I stand for let's say hour and a half or 2 hours, my knee swells up like a football, and so I don't know.
I'm not a doctor, but I would say don't stand for 2.5, 3 hours.
I mean, unfortunately, some people don't have a choice, for their work, and, they have to do that. So what I would tell you, David, is that I think you should probably see an orthopedic surgeon and talk about your option. They need to get some x-ray and evaluate you and just have an honest discussion with you on whether or not the surgery should be considered for you. It sounds like you're pretty miserable, you're very limited, and I think we have technology to make you better so you don't have to live like that.
So there are people who are in their late 50s now getting total knees, and those knees last a long, long time then?
Yes, I mean, that's, like I said before, I think that's by far the fastest growing segment in our patient population. The people in the 50s was bad joint that required joint replacement. Whether or not this is going to last you a whole lifetime, that's a different story. But I can say that, the statistic would show that, at 10 years, there's a 90% chance that your knee will still be functioning very well.
Okay. Well, good. Well, thank you then.
Thanks for the call,
Thanks
David.
For calling,
good luck.
David. All right. Whew. How long are they going to last? Knees. You've seen the $6 Million Man. For God's sake.
Yeah.
How would
I wanted to get one more question.
How would someone get a hold of you, Dr. Huang, at the Everett Bone and Joint?
I think the best way is to either call us at 425-339-2433 or go onto our website, everboneandjoint.com. One long word, everboneandjoint.com. We have some very useful information for patients regarding different disease process.
I'm calling. Stick around. Health Matters with Shannon O'Kelly and myself, Maury Eskenazi. We're coming right back. We have a few more things we got to talk about the knee before we go.